counting down, and 5, 4, 3, 2, 1.
Good evening, everyone. Let me first apologize for this late start, as we all were in cabinet, and we will be returning to cabinet immediately after this press conference. My fellow Turks and Caicos Islanders, residents and visitors, I am here this evening to give an update on COVID-19 and what we have been doing from a health perspective. We have had a huge surge in cases over the last 2 weeks. The Ministry of Health is actively working to bring cases under control. There is much concern about large gatherings. If we are to control this pandemic, it will take all of us heeding to the guidelines and taking responsibility. COVID-19 is most likely to be with us for the next 18 months to 2 years in some form or the other. We need to adapt to our new norms. It is up to us whether we beat COVID-19 or not. We need to imagine, invent new ways of doing old things. It is critical that we all take personal responsibility to slow the transmission of COVID-19. Take individual and collective responsibility to adhere to the COVID-19 prevention measures that include, as mentioned, physical distancing, hand hygiene after touching high-touch surfaces that might be contaminated, and social distancing. Avoid mass gathering. I cannot stress that enough. These measures will avoid your risk of being exposed to COVID-19. We have increased testing, and we have added 1 new additional staff to our public health laboratory team, which increased our testing capacity. Contact tracing has increased, and this is evident in the number of cases being identified. I pause to thank our healthcare workers who are daily on the front line and are working tirelessly to ensure that we all are safe. I applaud them for their countless hours of selflessness and dedication. I will now present an outline on the infection and actions taken since June 22nd, 2020. On June 22nd, 2020, the Ministry of Health was notified that 2 new cases of COVID-19, a returning resident who had been in quarantine and tested as part of the repatriation protocols, and a symptomatic community member with no known epidemiological links to a confirmed case. A total of 25 primary and 3 secondary contacts were investigated, quarantined, and tested as part of the contact tracing. 1 of the primary contacts subsequently tested positive. On June 25th, a TCI resident who had attended an event with several other persons in the community tested positive for COVID-19. Contact tracing efforts revealed a total of 25 primary contacts and 77 secondary contacts, who have all been quarantined. Of these, a total of 12 primary and 11 secondary contacts have tested positive, bringing that number to 23 new positive cases. On June 26, a symptomatic resident who had been hospitalized tested positive for COVID-19. No clear epidemiological link to a confirmed case was reported. Contact tracing efforts had revealed a total of 8 primary and 5 secondary contacts. 1 primary contact tested positive. However, I regret to say that that case has since passed away. And one death is too many here in our population. Between June 29th and July 5th, a total of 5 persons tested positive for COVID-19. 2 were not linked to any confirmed case. A total of 13 primary and 14 secondary contact tracing related to those 5 cases were investigated. 2 of the primary contacts tested positive. 205 persons are currently undergoing quarantine and observation. 4 COVID-19 patients have been admitted to the Cheshire Hall Medical Center. Fortunately, none of these patients require ventilation at this time. However, 2 are in the negative pressure rooms and 2 are occupied in 2 additional rooms. Active case investigation is ongoing by the public health team, and testing has been prioritized for the outbreak and emergency referrals overseas through the treatment abroad program. There have been challenges in relation to persons complying with contact tracing efforts, including those who have tested positive, which makes it difficult to ensure that all contacts are identified, quarantined, and tested in accordance with the established protocols. There has been 1 additional death as a result of COVID-19, bringing the total number of deaths since the pandemic began here in the Turks and Caicos Islands to 2. The TCI is mandated to report on cases of COVID-19 to the United Kingdom International Health Regulations body as a focal point. This information is shared with World Health Organization, WHO, and is posted online along with information for all countries. The TCI has had to revise its previous classification from no cases to clusters, as well as report on additional cases and 1 death. TCI must report each additional case to the International Health Regulatory Body for onward submissions to WHO. The Ministry of Health is still actively testing contacts and suspected cases. I can say here today that tomorrow's dashboard, you will see a reflection in the increase in cases, as the public health laboratory are now actively testing samples as we are here, and we have been getting preliminary results back. So I can say right now that at least 11 additional new cases you may see tomorrow, at least 11, and being reflected in tomorrow's dashboard. In addition, we are commencing the evaluation of persons who have tested positive on June 22nd, June 25th, and June 26th, in order to ascertain if these persons have fully recovered. Those are the persons who tested positive June 22nd, June 25th, and June 26th. 14 days have since passed, 14 to 16 days, and now these persons will be evaluated to see if they are free of the virus and have fully recovered. And if they present 2 negative COVID-19 tests, they will be then included in the recovery numbers of the dashboard. Due to the rise in new cases, Cabinet met. Cabinet took this up as an agenda today, and the following extension to the public and environmental health control measures COVID-19 Providenciales Regulations 2020 will come into effect tomorrow, July 9th, 2020. Number 1, curfew. A curfew is imposed on the island of Providenciales from 8 p.m. to 5 a.m. every night starting July 9th, 2020, 5 a.m. until July 20th, 2020. Every person on the island of Providenciales shall, during the curfew period, under sub-regulation 1, remain confined to his place of residence, inclusive of a yard space, to avoid contact outside of their family, except 3A, for essential travel to and from the doctor or hospital. B, an attorney for travel to and from a police station. C, essential workers who are directed to report to work by the persons in charge of the service. B, businesses to close at 6 p.m. Delay and reopen. Number 2, delay and reopening of certain businesses. Notwithstanding Regulations 10.3 of the Emergency Powers COVID-19 Number 5 regulations, the businesses specified as falling within the provisions which are scheduled to reopen on the 4th and the 6th of July 2020 pursuant to that provision shall remain closed until July 20th, 2020 at 5 a.m. 2, the businesses referred to in subregulation 1 includes A, hotels, B, dine-in restaurants, C, casino, bars, and discotheques, D, gyms, spas, and fitness centers. Number 3, religious places of worship extension. Notwithstanding to Regulation 25 of the Emergency Powers COVID-19 Number 5 Regulations 2020, from June 30th, 2020 until July 20th, 2020, no more than a maximum number of 10 persons shall be allowed to be inside a religious place of worship at any given time. Number 4, funeral services and burial grounds. Notwithstanding to Regulation 21.3 of the Emergency Powers COVID-19 Number 5 Regulations 2020, from June 30th, 2020 until July 20th, 2020, a maximum number of 10 persons of the immediate family may be permitted to attend a funeral service, and at least one officiant and essential mortuary staff, which shall be approved by the Chief Medical Officer. Number 5, social activities, sports, and training. Notwithstanding to Regulation 22.3 of the Emergency Powers COVID-19 Number 5 Regulations 2020, from June 30th, 2020 until July 20th, 2020, a maximum number of 10 persons may be permitted to attend weddings, no social gathering of any description with persons living outside of the same household, notwithstanding to Regulations 22.4 of the Emergency Powers COVID-19 Number 5 Regulations 2020. A, sports event and contact sports shall not resume until July 20th, 2020. B, outdoor camps limited to 10 persons. C, indoor camps must have permission from the Chief Medical Officer. D, boating activities limited to 4 adults living inside the same household. Number 6, restrictions on domestic travel. Notwithstanding Regulations 24.4 of the Emergency Powers COVID-19 Number 5 Regulations 2020, a person desirous to return to his home in Providenciales may travel from any other island into Providenciales. However, from June 30th, 2020 until July 20th, 2020, except for essential travel. A person shall not be allowed to travel from Providenciales to any of the other islands. Notwithstanding Regulation 24.6 of the Emergency Powers COVID-19, number 5, Regulations 2020, commencing the 20th of July 2020, a person who is desirous of returning from Providenciales to an island he ordinarily resides on may travel from Providenciales to his home, provided that the airline shall maintain a travel log and reduce the numbers of persons permitted to permit physical distancing. For the purposes of sub-regulation number 1, travel for the purpose of banking, doctor and hospital visits, funerals, construction work, emergencies, and cargo shall be considered as essential travel. Number 7, public beaches. Notwithstanding Regulation 25.3 of the Emergency Powers, COVID-19, number 5, Regulation 2020, from June 30th, 2020, no gatherings of not more than 4 adult persons outside the same household may be permitted at a beach. Number 8, persons in high-risk categories such as those over the age of 65 or with underlying conditions shall be recommended to shelter in place. In closing, this evening we are expecting 27 residents to return home from South Florida, and this number will be reflected in the dashboard quarantine numbers tomorrow once they return and are in country. We wanted to be there at the airport to welcome them from a socially accepted distance, but the arrival time is now clashing with the press conference. So we are unable at this time to be in 2 places at once. We realize that persons are not calling the hotlines for various reasons. Some out of fear of discrimination, fear because they may be illegal, fear of the unknown. It is critical to call the hotline if you experience chills, repeated shaking with chills, muscle pain, headaches, sore throat, and loss of taste and smell, and even diarrhea in some cases. You will note that there are a lot more symptoms, signs and symptoms, than the ordinary stated fever. Dry cough, fatigue, shortness of breath, to name a few. If you know you have been in contact with someone who has been diagnosed with COVID-19, call the hotline. Even if you have no symptoms, call the hotline. Not everyone has symptoms. Together we can reduce and contain the spread of COVID-19. But we all have to do our part. We have to be responsible, not only for our health, but the health of the nation. Thank you very much. And I'll take some questions at this time before we resume back. Carol.
Okay, Honorable Minister, is Todd Lane from The Sun. As the Minister of Health, how do you feel about the climb in these numbers? Like, can you give us an idea of where these numbers are coming from? Are they work-related, events, parties? Where are these numbers coming from?
Thank you very much. As you know, as we continue to do contact tracing, we will see exactly who they are. We are hoping to have a complete picture of the contact tracing with mapping, with the surveillance mapping, where we can put dots on various communities, clusters to identify by the weekend. That work is ongoing, so we can have a complete picture of what is going on here and in the TCI. However, we can say that the data revealed that the one person who had went to the event at a particular place had infected at least 12 persons. And those 12 persons you do the multiplier effect, have it infected at least 11 persons from the data. So each one of them infected, one person infected 12, and each of those 12 infected 0.9 something of a person. And then that continued. So you can see how it can escalate going forward. But we are scheduled to have this data pulled together by the weekend so we can present a picture to the general public that includes the mapping with dots where you can see all the clusters here in Providence Alice.
Okay, so let's fly back to the data. Are there any testing being done on children?
Any testing?
Being done on children?
On children.
Children.
We have tested children. However, the problem with testing children is with the pushing the swab in their nose.
Mm-hmm.
We are hoping that by the end of this month or next month, we will have the technology here to do throat swabs. However, the throat swabs, you're looking at the concentration of viruses to get amplification on the PCR. So we are examining to see what new technology will be in place so we can actively test children, of a certain age.
Okay.
Because you can use the throat swabs at the time, but we don't know how accurate that will be in presenting the sufficient viruses for isolation and detection.
Okay. Since the task force has been launched, can you give us an update on that, on the task force, the COVID-19 task force?
They started, I haven't gotten the full report.
Mm-hmm.
However, I know they have started their activities. I believe the numbers are 5 here in Providence Alice, 5 to 6,
Mm-hmm.
Depending on if the next was somebody, whether they take up their post or not, that was pending, and 4 in Grand Turk. We have 1 in Middle Caicos. We are waiting for other persons to take up the post and the other islands. Now that is just the beginning. As we move on to the opening, we have to see how we can strengthen those numbers and what staff we can move into the Ministry of Health if necessary.
Okay. As it relates to testing, can you tell us about the turnaround time? Are we receiving tests fast enough? Are they slow? How's it
The
coming?
turnaround time, we all know we have 4 different PCI analyzers in operation.
Mm-hmm.
The turnaround time is very fast. However, we have to wait for the samples to come in before we test. The lab can only test when the samples are collected from those contacts out in the field.
Okay.
Persons are scattered throughout Providence Alice now. It's not clustered in just one place, and we have to, the public health nurses have to go out into the field, actively seek and find those individuals to be tested, collect the swabs, and bring the swabs back to the laboratory, and then they are tested. Most nights, the lab staff are there until 11:30, 12 o'clock in the night, testing samples.
Okay.
So we are running the late night oil. But the time for the machines to run the test, we can have it right away, provided we have the samples there to test.
We have some questions coming from magnetic media. It says, what is the increase in cases due to? We notice in the releases many cases are with no known, with no original.
Can you repeat the questions for clarification?
What is the increase in cases due to? We notice in the releases many cases are with no known origination.
Yes. As I stated in the release that certain cases we cannot completely do the contact tracing due to lack of information. If someone interviews me and say, Minister, where do you live? I say, I don't know. Someplace in the Turks and Caicos Islands. Minister, do you have a wife? I don't know. Minister, do you have children? No, I don't have no children. Whereas I have 2 or 3. So we are dependent on persons to give us that information that we can do the contact tracing and see where they work, where do they live, who do they live with, in order to get a complete picture. But once we have gaps in the information, we cannot adequately connect the dots, to see who is related to who. If I do not say, well, yesterday I was hanging with Honorable Ewing, and then I start feeling sick. So I'm not given the information that is needed for them to go and look for that other person who have been around to say, okay, well, let me see if Honorable Ewing is positive and who he have been hanging with and who he have living in his house. So that is some of the information, that is some of the bottlenecks that we have here in doing the contact tracing and finding out who is related to who, linked to who.
A second question from magnetic media. Are there plans to, put greater restrictions in place, to reduce the amount of
Yes.
cases?
Well, of course, we just read through them, so I don't know if she was listening to the restrictions that was just outlined. And also, we are actively reviewing what is going on now, and we'll be coming back for any additional measures. So this is a fluid case. We are seeing what is happening now with the increase in cases. These are the measures that were discussed and approved in cabinet today. However, we are closely watching what is going on to see if any additional measures to these that were outlined this evening will be in place.
One coming from an independent media house, and they are asking if there's any consideration being given to pushing back the July 22nd reopening date.
At this time, we are looking at what is happening. And depending on what the data is presenting us, we will make a choice at that time. But this will be driven by data. We will let the data drive our decisions, what we are seeing, the health, what are we seeing from a public health point of view, we'll decide that decision. So we are right now strongly reviewing everything that is happening, the cases, the clusters, who is being affected, trying to get all the information to see how that will influence those states going forward.
And what's the benchmark, what's the benchmark for you deciding on that data before making that decision?
A benchmark in terms of number of hospitalizations, there isn't most persons, most countries, when you see them, they will say if we see an increase in tenfold of hospitalizations or new cases, what we are doing is trying to see, quantify those cases. Because if 50 cases, but they are in one household, do you say, well, we cannot open? Or 100 cases just linked to, for instance, beauty salon, and you can isolate them. So we have to see what actually quantify those cases, not just look at the numbers and say, okay, if we see an increase in by 14, we're gonna shut everything down. Because those 14 might be just 14 persons who attend one function. So we have to qualify, not just quantify what has happened, but we have to qualify the data also. So we decide not to just go by a number, because the numbers might be misleading. You know, it can say one thing, oh, we have 50 new cases, but all those 50 persons were on a boat this weekend hanging out with the minister or something. You know, or at the minister's house partying one night and all 50 cases came down. You know, so we have to qualify, not just quantify a number to say this number and then we shut down.
Just for clarification, will returning residents be required to provide a test result? Will they be required to self-quarantine for 14 days? That's returning residents before July 22nd and after.
Now what is going on now? No, returning residents are not required presently to have a COVID-19 test result before they enter the country. But you know, they go through the 14-day quarantine and tested before they leave quarantine. That is currently what is happening. We are in talks with the Ministry of Tourism to finalize everything once the borders open. We have made some recommendations and we'll see where those recommendations go, you know, concerning returning residents, of course visitors once July 22nd or whenever we decide to open the borders.
A question from Weekly News, any consideration being given to restricting flights from the United States or cities where there's been an increase in cases?
I can say that consideration is being given to almost everything at this time to keep our residents safe. And we are doing the balance of balancing lives and livelihoods. And if it needs at the time when we are ready to open that we have to restrict flights from certain countries, suddenly I know the recommendations will be made to cabinet and it will be deliberated on to see where we go from there. But we are reviewing and seeing what is happening in the United States, what Canada is doing, all our source markets, especially South Florida, New York. We're seeing New York, what is happening in New York, so we have the team watching what is going on so we can make an informed decision at the time, when the time comes.
Okay, just for clarification again, when visitors are traveling here, where will their insurance and PCR tests be validated? Will they have to show it off at the departure city, or will it be checking at arrival to TCI?
That is something that is being discussed now between the Ministry of Health and Ministry of Tourism.
Mm.
We have had a number of meetings, stakeholder meetings, concerning this, seeing what each country in the region is doing, how they had to pull back, what they had to add, what they had to subtract from their opening. We have seen what Jamaica have done and the measures that they have learned. So while we, at this time, this lull time, we are watching what our Caribbean brothers and sisters had to include or exclude. So we are having those discussions, and we will be finalizing them shortly with my colleague, the minister from the Minister of Tourism, and our respective ministries.
Okay, I have one more question. How much essential workers have been tested so far?
Essential workers. Now, when the outbreak started, we had moved to essential workers pre-June 22nd. But as soon as the outbreak started, we had focused all our attention on contact tracing and suspected cases. So as soon as this decreased a little bit, we'll go back to the normal testing protocols. Or if it's prolonged, we will have to adjust our testing to say, okay, so much will be for this, so much will be for that. But at the moment, all our focus is on contact tracing and getting to test those persons who may be in contact with somebody who have been positive.
Minister, while you take a look at that, there's some speculations ongoing in relations to maybe the dockyard situation, and there is even some other speculations that we have been aware of, which we're not sure how true those are, in relations to the detention center. Have you been having your team go out to test based on those rumors of cases that may erupt in any of those
Thank you very
locations?
much for that. Of course, those rumors have reached our desk, and certainly the desk of most ministers, the situation or the alleged situation. And that is now being investigated to see what exactly is the occurrence, if any, and that will be acted on, as soon as we have that data. Because we are concerned about any cluster or any particular area. So we have to go in and do the necessary groundwork and to see what is going on there, and then come back and make an informed decision based on the numbers, based on the science.
One last question coming from Magnetic Media, and then I think we're gonna wrap it up because we have cabinet that we need to continue. Medications. We've had another death due to COVID. Is there any movement on introducing drugs which WHO, UK, and others, are we taking cues from them to help any our cases of COVID-19?
Yes, any drug or any measure that show promise and have gone through the test and trials and are qualified to perform the test, approved, FDA approved, all the different approvals from Canada to UK, all the various approved. We will definitely consider that if it can help us in the fight of COVID-19. We are looking at what drugs are out there. We saw the rise and fall of many drugs during this time. We can know about the hydroxychloroquine and all of that, all the other wonder drugs that came out and was so sexy at the beginning, and just to see them fall. So once these drugs have passed all the clinical trials, all the testing, and they are approved, we definitely will be taking a look at what we can get here, for our population.
I have one short question, just
We have to wrap up at the moment because we have to resume cabinet, but if you want to, you can send your questions to Premier's office and we will facilitate an answer for you.
Okay, so I'll take the short question and wrap up.
Okay, there's been local businesses that have staff that have been tested, and we have one that put out the report today. How do you feel that they took the liberty to actually close their business down? How do you feel?
No, persons need to be proactive. As we say, this is everyone have a stake in this, and we all want people to be proactive and protecting the health of their employees, their personal health, and the health of our nation. So if anyone who come forward and say, look, I'm feeling sick, let me call the hotline. We encourage people and we praise people for stepping forward. And any business who feel like they have a situation going in their department, nip the bud. If you have to close and send all your workers home, do that. Protect the people, protect yourself, and protect our nation. And like I said, I'll take any questions. You can send it to me tomorrow, and I'll answer any and all questions as needed. Thank you very much.